Morning. I'm Miss Sams and I'll be taking care of you today. How are you feeling this morning? I'm glad to hear it. So it looks like you're here for a Mohs surgery this morning. Has the doctor explained the procedure to you before? Well, let's go over it again now before we finish getting you ready. The Mohs surgery today is to remove the basal cell carcinoma that was found on your zygomatic bone. That's your cheekbone. Now, basal cell carcinoma is one of the most common types of skin cancer, and it usually develops due to excessive sun exposure. It forms in the basal cell layer of your skin. That's the deepest layer of your epidermis, which is the outermost skin layer. Luckily, this type of cancer rarely spreads past the original tumor site, and it's easily removed by the doctor. The dermatologist performing your surgery today is Dr. Jones, and she's done this procedure several times before, so you're in good hands. Now, this procedure can take some time to complete because of the way it's performed. The area surrounding the tumor will be numbed by our anesthesiologist, and then the doctor will go in and remove a layer of skin. We'll bandage this area up while the doctor examines the layer she removed under a microscope to determine where the cancerous areas are located in the skin sample. After that, she'll have you come back into the operating room, and she'll remove another layer of skin to examine. This process will continue until there are no more cancerous areas left on the skin removed. I know it seems a little tedious and it's very time-consuming, but this method has a 98% cure rate and it's the highest of any available treatment. And it also spares as much healthy tissue as possible. Now, it's very important after the surgery to keep the incision area covered for at least the first 24 hours, as well as making sure to keep it clean and dry. You can remove the bandage after 24 hours unless the doctor asks you to keep it on for longer. The incision will be red and tender for a little while after surgery, and this is perfectly normal. However, if the redness spreads, the pain increases, or you notice any pus coming from the incision, please call our facility immediately to have a checkup on it because we want it to heal just as healthy as possible. While you don't have to keep a bandage on the incision after the date the doctor tells you it's safe to remove it, some people do wear bandages to help protect it. Now, there is a risk of scarring, but if you take good care of the incision while it's healing and try to limit some sun exposure for a couple of months afterwards, you can really minimize that risk. We want you to come back to have your stitches removed in 2 to 3 weeks. What time frame works best for your schedule?